Hello, ma'am. Hello.
Yes, I'm here.
Okay. Can we wait for some time, ma'am? Other participants can join.
Yes, sure.
Okay. Thank you, ma'am.
Caregiver does not feel okay. Caregiver does not feel okay, then it's very important. Caregivers are not okay. How do you take care of the elderly person? It's very important. Even if 21st September happens to be World Alzheimer's Day.
Apurva?
So, yes, sir.
Yeah.
Can we start the session, sir?
Yeah, that's what I was also thinking. So we have list. Yeah, I think we will start off. Let us see. I think who is hosting? Like we can start off.
Okay,
Let's
sir.
go ahead and the group will join. Yeah.
Good evening, one and all. Welcome to Vayomanasa Sanjeevani Monday webinar series. As we know, September month is World Alzheimer's Day, World Alzheimer's Month, and 21st September is to be observed as World Alzheimer's Day. And as part of it, we are conducting various programs related to Alzheimer's for promoting the awareness regarding the disease and among the society. Today, the topic of the day is Alzheimer's dementia, and the speaker is Dr. Apurva Mittal. I welcome Dr. Apurva to the session, and I also welcome Dr. P.T. Shivakumar, sir. And with that, today's moderator of the session is Ms. Annapurni. For introducing her, she is doing fellowship in Geriatric Mental Health Care Nursing. And I welcome all the YouTube and Zoom participants to the session. Annapurni, please join.
Yeah, thank you, Lima, for your brief introduction. And as she has introduced, this is the Alzheimer's month, and VMS is performing various activities, and one of which we have initiated, that is the presentation on Alzheimer's dementia by Dr. Apurva. To introduce her, she has done her MBBS and DPM from Manipal University, and MD from KS Hedge Medical College, NITTE University, and she has been worked as a senior resident in community psychiatry for a year, and currently she is doing her postdoctoral fellowship in geriatric psychiatry. I welcome you, ma'am, and over to you. Thank you, ma'am.
Thank you, Annapurni, for this kind introduction. Is the screen visible?
Yes, ma'am.
Is the screen visible? Okay, cool. So thank you so much for the kind introduction, and thank you, Vayomanasa and NIMHANS, for giving me this opportunity to speak today. Without taking up more time and before further delay, I would like to start with today's presentation. So one question is that why are we suddenly talking about this, or why are we suddenly reading this? Why are we suddenly having this kind of seminar? So first is that like how how Annapurni and Lima said, that 21st September happens to be the World Alzheimer's Day, and it's good to have general knowledge about why are we even celebrating this day. But more importantly, why do we need to know about Alzheimer's dementia is that we all know that as a population, as a community, all of us are getting old. Our parents, our grandparents, our colleagues, ourselves, all of us are getting old thanks to the lifespan which is going on increasing. Lifespan which is increasing. Now, as a community, the least we can do is just know about what kind of illnesses that can happen to a geriatric population and what all can we do to avoid that or to prevent that. Now, there's this common saying that what the mind doesn't know, eyes cannot see. So for our mind to know that there is something called as dementia, there is something called as forgetfulness. What is dementia? What is forgetfulness? What is pathological? When do we need to seek help? We all need to know all of this so that we can improve the further quality of our lives. So in today's presentation, I'll be basically talking about one, what is dementia? Two, we'll speak about who all are prone to get dementia. Next, we will see what are the causes of dementia, or why does dementia happen at all? What are the signs and symptoms, or how do we know if somebody is actually having the problem of dementia or not? What are the investigations we commonly do and why do we do that? What are the treatment modalities? How is the future? How is the prognosis? How is the quality of life of somebody who gets dementia? What are the tips for us? Us meaning the healthcare workers or even the general population, everybody. What are the simple tips for us? And all of this we will substantiate with a couple of case vignettes. So at any point of time, if you feel you're not able to understand, or if there is any kind of doubt, please stop me then and there, and I'll be more than happy to answer questions. So let us first start with a story. Now, this is a real story. In the year 1901, there used to be a patient called Auguste D. She was a 51-year-old female, and she was brought by her husband with some symptoms of being suspicious, not trusting people, feeling that everybody around her is lying to her. She had a few sleep disturbances, which was going on with the progressive cognitive deficit. She was forgetting more and more where she had kept what. When she would talk, people would not be able to understand. She would be very irritable and aggressive. And eventually it was going on progressing to some kind of confusion. Since the symptoms kept on increasing, this patient, Mrs. Auguste D, she was kept in hospital till her death for about 5-6 years, and her condition continued to be deteriorating. Finally, when she passed away in the hospital in the year 1906, her doctor, whose name was Alois Alzheimer, he autopsied her, opened up her brain, and tried to study it. What he found was something very interesting. What he found was that there was some abnormal clumps and some tangled bundle of fibers, along with the fact that her brain was smaller than the usual brain. So he would have found something like this. You see a normal brain here. Her brain would have been something like this, the below one. The brain is a little smaller in size, and we can see some black plaques kind of thing also in it. So maybe he would have found the brain to be looking something like the bottom picture. So this is how the word Alzheimer's came. On the name of the inventor of this illness, Alois Alzheimer. And this is how we're going to be talking about dementia, predominantly Alzheimer's, but we will also speak about a few words about other types of dementia as well. So dementia is basically a constellation of symptoms which talk about the decline in the brain functioning. It's a neurodegenerative disorder, which means that the brain and the nerves and the brain and basically the nerves are kind of decaying or are kind of degenerating. Dementia is can affect the memory of the person. They can affect various thinking skills. They can affect orientation of the person. They can affect planning. They can affect the way they see, the way how to plan, how to go here and there, how to behave in public. Multiple mental abilities are affected when somebody has dementia, and eventually it comes to a level when somebody is not even able to perform the simplest of the tasks. Dementia is basically of two types, early onset and late onset. When somebody starts having onset of symptoms before the age of 65, it's known as early onset. And if somebody starts having onset of symptoms after the age of 65, it's known as the late onset dementia. Now coming to the people who can be prone to developing dementia. Everybody in this world does not get dementia. How do we know, or how do we get to know who can get dementia? These are certain risk factors which actually, interestingly, start at a very young age also. So for example, there is less education. This is by the Lancet study, which was done in 2020. This basically talks about the 12 very important risk factors which can put somebody and make them prone to dementia. So the risk factors are something like somebody having lesser education, somebody who's not able to hear properly, somebody who's had some kind of brain injury, accidents, somebody who's had hypertension or diabetes, somebody who drinks, somebody who smokes, somebody who's more chubby, more obese, have a sedentary lifestyle, physical inactivity, somebody who is having depression, have social isolation, and somebody who resides in a place which has high degree of air pollution. Now, coming to understand why does dementia happen at all? Like, what are the changes which happen in the brain which causes dementia? To put it very simply, we need to understand that as we age, most of our body kind of starts shrinking. So that's exactly what happens in brain as well. The size of the brain keeps on shrinking. Secondly, just to understand it simply, there is deposition of some bad protein which gets deposited in different parts of the brain. There are certain inflammation changes. There may be some dysfunction within the organelles of the cell, and there might be some neurotransmitters insufficiency, which can also suggest us on what medications, etc. to give. So overall, what we need to know is that one, the brain becomes smaller in size, and there is deposition of some unwanted or bad protein, which leads to dementia. So what are the common signs and symptoms, or what are the symptoms by which we should suspect that somebody is having dementia? First starts with memory problems. What do we mean by memory problems? People will come up with symptoms like they misplace the specs, they don't know where they have kept what. If somebody is cooking, then they forget to switch off the gas. The milk comes out very frequently, or they forget if they've locked the door or not. So various memory problems when they're not able to remember if they have done that particular activity or not. Some memory loss which disrupts their daily routine. So for example, somebody is very used to of going to a market and purchasing things. Now they're not able to. They don't know where to go. They have forgotten the ways, or the number of lists, number of items in their list which they have to purchase from the market. They forget that. They repeatedly ask questions. Have I eaten food? Did you do this or not? Have you kept my jewelry safe or not? These kind of questions are very repeated. Some people may have trouble handling money and some money bills. So they may not be able to exactly tell how much money they should be giving, how much money they should be collecting. That understanding that calculation may become a problem. Sometimes people may have difficulty in doing very familiar things at home or at work. For example, dusting the house or arranging things within the house, or while at work, how to arrange the files, what is the, if they have some calculation work, they may not be able to do. And often even at leisure. So for example, somebody is watching TV, they may forget which channel comes on what, which channel comes on which number, or how to operate a mobile phone, or how to operate a television remote, etc. They may have poor judgment. If there are certain decisions to be taken in the family, they may not be able to participate in it. Misplacing things, like I said, and there may be changes in their mood, personality, or behavior. Now, we need to understand that all these symptoms may not come in one go in one person. It's like the dementia is more like a spectrum. It starts with some small deficits, and it then may worsen to something being almost bedridden. So how do we understand that? Dementia basically is divided into, for our simple understanding, it's divided into early stage, middle stage, and late stage, or mild dementia, moderate dementia, and severe dementia. In the early stages of dementia, when the problem is relatively milder, patient may present to us, or person may present to us when they are being a little forgetful. Like they just forget small activities or small things. They may forget going to familiar places. They may have some name finding difficulty. They're not able to remember distant people ka name, distant relatives' names they may forget. They will know that, okay, they will know that if you show them a pen, they will know it's a pen, but they will not be able to say that it's a pen. Arey, this is something with which we write, or we write with this on a piece of paper, and so on. But exactly the name pen, that may be difficult for them. And they may lose interest in certain previous activities. Whatever they used to enjoy, they may lose interest in that. Then in the middle stage, or in the moderate stage of dementia, they may present with changes in sleeping pattern. Their sleep might get a little disturbed. They may become suspicious or irritable. The reason of that being that they forget that most commonly it happens for something valuable like jewelry or some heavy amount of money. They forget they've kept at a particular place, and then they become suspicious. Has somebody taken that? That person would have taken this, and so on. They are unable to do simple tasks like cooking. Now, cooking, financing, all these things are executive functions. So these are complicated activities. Whatever has been their routine for so many years, they might start making mistakes in that. So they may not be able to do it. They may not be able to plan. They may not be able to say somebody is used to of making food for 2 people. If suddenly 5 people come, they may not know how much food to make, or how much proportion of rice to add, water to add, and so on. They may forget events in their own lives. When was my anniversary? What is my birth date? Who is the person coming? They may not be able to remember the names. Often at this stage, they might need help with personal care. They are able to do their activities of daily living. Like they might be able to do their bathing. They might be able to do eating, toileting, walking around in the house, but they might sometimes need some kind of assistance. And there may be symptoms of them wandering. They forget ways, so they may be wandering here and there, and repeated questioning. In late stage, how we understand is that they're completely unaware of time and place. They don't know where they are. They don't recognize people around them. And they need more and more help for their routine activities. There will be behavioral changes. There may be incontinence, wherein they don't know where to pass urine. They don't know where to go to the toilet. They may not be able to take bath at all. And they may have swallowing difficulties. So broadly, to understand the spectrum of early, middle, and late, how we remember it as how broadly we understand it as in early stages, there is this forgetfulness, but they're able to do their activities of daily living. In middle stage, they might need some help. There may be some behavioral changes, but they are still able to kind of live independently. But in late stages, they are absolutely not able to live independently, and they always need assistance for their routine lives. To make this part understand it even more, I would like to show a small video. It's a very simple video, how the pathology happens and why it happens. This is just to understand as to what exactly the pathology is and why do those symptoms happen. So let's have a look at it. It's a very small 2-minute video. Please let me know if it's not audible.
It comes on gradually as 2 abnormal protein fragments called plaques and tangles.
Is it audible?
Yes, ma'am.
Okay.
Accumulate in the brain and
We
kill.
can't see the video.
Can't see the video. Okay, I'm
They
sorry.
start here.
Only audio we can able to hear, not the video.
Okay, I'm sorry. 1 second. Now I'm guessing it should be visible.
Yes,
Is it
ma'am.
visible?
Yes.
The disease comes on gradually as 2 abnormal protein fragments called plaques and tangles accumulate in the brain and kill brain cells. They start here in the hippocampus, the part of the brain where memories are first formed. Over many years' time, the plaques and tangles slowly destroy the hippocampus, and it becomes harder and harder to form new memories. Simple recollections from a few. After that, more plaques and tangles spread into different regions of the brain, killing cells and compromising function wherever they go. This spreading around is what causes the different stages of Alzheimer's. From the hippocampus, the disease spreads here to the region of the brain where language is processed. When that happens, it gets tougher and tougher to find the right word. Next, the disease creeps toward the front of the brain, where logical thought takes place. Very gradually, a person begins to lose the ability to solve problems, grasp concepts, and make plans. Next, the plaques and tangles invade the part of the brain where emotions are regulated. When this happens, the patient gradually loses control over moods and feelings. After that, the disease moves to where the brain makes sense of things it sees, hears, and smells. In this stage, Alzheimer's wreaks havoc on a person's senses and can spark hallucinations. Eventually, the plaques and tangles erase a person's oldest and most precious memories, which are stored here in the back of the brain. Near the end, the disease compromises a person's balance and coordination. And in the very last stage, it destroys the part of the brain that regulates breathing and the heart. The progression from
So I hope that was slightly clear as to why does dementia happen and how do the symptomatology happen basically. So how we understood from the video that the dementia kind of, or the deposition of those bad proteins kind of start getting deposited from somewhere within, inside the brain in the center. And then it goes like this. It goes from here and then goes it behind, eventually first destroying the memories. How we say that immediately the person is not able to remember the recent memory deficits, like they forget things where they have placed and so on. Then they forget the names. Then they forget the main planning and the executive functions. Then eventually they forget, they don't remember the emotions. They are not able to express emotions. And then finally, the most important, memories, which is located in the back of the brain. And eventually, when it worsens, when that deposition happens in the area of the brain, which is responsible for breathing and responsible for the heart, if it gets deposited there, the person eventually dies. So this is how the progression of dementia happens from small to big. Now, the forgetfulness actually happens in most of the people. As we grow old, everybody will have some or the other cognitive deficits. Some amount of forgetfulness will be there. But then when it starts affecting the daily routine, when it starts affecting the functioning of the person, that's when we have to be alert. And that's when we have to try to seek help and prevent it from further progression. There are different types of dementia. What we spoke about so far was predominantly Alzheimer's dementia. Apart from that, there are other types of dementia like frontotemporal dementia, vascular dementia, Lewy bodies dementia, Parkinson's, and reversible dementias. Now, in frontotemporal dementia, what we saw, the video, what we just saw was kind of overall the involvement of the entire brain. In frontotemporal dementia, it's the front and the side part, the brain, the part of the brain which is responsible for memory, and the part of the brain which is responsible for behavior of the person, that gets affected. So that comes to us in the form of person having behavioral changes, not memory, not much of memory, but it's more of behavioral changes. They will behave in a strange way. They won't show much emotions. Their language will be haphazard. Behavior-wise, they may want to do certain activities over and over again without any logical explanation to it. They may become more aggressive, then become more irritable. In vascular dementia happens usually secondary to some vascular insult to the brain. People might have hypertension, diabetes, some stroke, heart problem. Secondary to that, if there is some cognitive decline or some forgetfulness, that is known as vascular dementia. Then there is something called as Lewy body dementia and Parkinson's dementia. In Lewy body dementia, the character symptoms are when patients start seeing things which are not there. They might start having hallucinations, or they will have sleep disturbances. They will talk in their sleep a lot. They will start acting out on their dreams. They may start walking. And of course, forgetfulness. Along with this, what is extremely important to us are reversible dementia. Now, mostly dementia, like we spoke, are neurodegenerative disorders, which we can't really stop. There are certain subset of dementias which are reversible, which means there is a cause, there is a reason why which somebody gets forgetfulness or somebody gets cognitive decline. Now, the incidence or prevalence of these reversible dementia is not a lot. It's not very common. But then even if there is a chance of somebody not having reversible dementia, even if it's 1% chance, it's worth it. So various causes which show symptoms of some cognitive decline are one, thyroid deficiency. Very often people who have hypothyroidism and it's not detected, they might present to us with symptoms of dementia. They may be forgetting, they may be slow. Then nutritional deficiencies like vitamin B12 deficiency or folate deficiency. Use of any substances like alcohol, smoking, or other substances. Then infections like syphilis or AIDS. So there is a panel, or there is a series of various, various causes which are responsible for reversible dementia, which we need to always know and rule out. This is predominantly for healthcare workers, but it's always good to know. So whenever we come across somebody who we are suspecting that they might have forgetfulness or cognitive deficits, we can ask them questions. We can ask the caregivers questions such as, do the person forget that they have eaten food and they ask for food again and again? Or do they urinate at inappropriate places? Are they able to button their shirts properly? Or are they able to drape their saris properly? Are they able to remember important dates like Holi, Diwali, or anniversaries? Are they able to express their opinions if at all there are any important family matters? Are there any new changes in the behavior are we seeing in them? Does the person forget ways, or do they lose their ways if they have to go to the market or if they have to come back, and so on? If there are answers to yes to most of these questions, say more than 4 or 5, if we get a yes to this, we should suspect cognitive decline or dementia. When should we refer? Now, it's good to know that there are certain kind of illnesses. There is some form of cognitive decline which happens in people. When should we be alert, or when is it a red flag? So when somebody is having a very rapid progression of cognitive dysfunction, most commonly when somebody has Alzheimer's, it takes about 7 to 8 years of time for them to progress to a significant level. When somebody's progression from one stage of dementia happening to another stage of dementia within a span of 1 year, we call it a rapid progression of cognitive dysfunction. When there is worsening and worsening in the impairment of worsening in their activities of daily living, like eating, taking a bath. When there is a focal neurological deficit, somebody has had stroke, somebody has had hemiparesis, not able to move. When somebody has headache, vomiting, fever, when there is a significant weight loss, when there is an injury, when there are behavioral disturbances causing injury to self or to others, or when there are seizures. In any of these states, it's extremely important to always refer to a specialist. Like I said, when we spoke about the reversible dementia, there are certain investigations to do for one, starting the medications, and second, to rule out if there are any causes of reversible dementia. If we can treat it quite often and quite to an extent, the cognitive decline may become better. So one, we start with complete blood count to see if there are any infections or not. We do liver and kidney function tests, which includes basically our electrolytes as well. In our setup, we also do sugar levels to know the diabetes status of the person, lipid profile. Now, all these are our usual routine biochemistry we do, one, to see if there is any other metabolic problem or not, and also to start a medication, we need to have all of this as a baseline, because quite a lot of our medications do affect these kidney, liver, and so on as well. Then we should know the thyroid function tests to see if somebody has hypo or hyperthyroidism or not. We should ideally do, in our setup at least, we do vitamin B12, folate, and homocysteine to see if there is a deficiency of any of these, and if we supplement it, person's cognitive decline may actually come down. Then an infection panel, which we, in our setup, we usually do sexually transmitted diseases panel, which is HIV, hepatitis B, hepatitis C, then we do syphilis, VDRL, etc. Then other infections like ESR and CRP. These are just some blood parameters we do to see if somebody has an infection or not. In some people who we are suspecting they might have a family history of carcinoma, we do autoimmune and paraneoplastic panel also. Very importantly, we try to do for as many patients as possible one kind of scan, at least CT or MRI brain, which will show us the shrinkage of brain, some kind of atrophy it will show in the brain, and ECG. That plaques and those bad proteins which I'm talking about, that's not seen in the scans, that's a autopsy report only. So pharmacologically, we usually manage it with some medications, which are either cholinesterase inhibitor, or it could be other medications like memantine. I don't think we need to go in a lot of details of it, but these are the common ones which are prescribed. What we need to know is the side effects to it. So the person might have some gastric irritability, a person might have headache, giddiness, bradycardia, some sleep disturbances, and so on. When till the time the side effects are tolerable, we continue the medications. And the whole point of giving medications is not for the memory to come back. The whole point of giving these medications is to prevent the further worsening. So without the medications, say the worsening of symptoms could have been in 2 years. With the medications, that worsening might push off to the next 4 years. So it's only to get just a little bit of more time for a better quality of life. Then there are some non-pharmacological treatments. In non-pharmacological treatments, especially with people with dementia, we have certain environmental modifications. So in somebody who has dementia, the place where they are living, it should be modified. Modified in the sense that that place should not be very cluttered. There should not be a lot of furniture there. Maximum one bed, one table, chair, and that's about it. Not a lot of things. The place where they are living, ideally there should be some kind of color coding, where is the bathroom, where is the door to go outside. Preferably the environment should have adequate lighting. There should be the floor should be ideally not slipping, like the floor should be kind of anti-skid kind of floors. There should be ideally railings they can hold easily and prevent slips and prevent falls. When they go to the bathroom, there should be side rails while they're taking a bath or while they're urinating or near the commode, so that it's easier for them to get up. There should be anti-slip carpets or anti-slip mats which help them to stand still. Then there are certain memory training exercises. Memory training, where we can just teach them on doing certain activities repeatedly depending on how their cognitive status is. If somebody is at a mild to moderate kind of stage, we can ask them or encourage them to do some cognitive exercises like playing puzzles or solving Sudoku, reading newspaper very regularly, making some memory charts, or making some writing a journal if it's possible for them. Then there should be adequate sensory cueing. By this, I mean it should not be hyperstimulation, there should not be hypostimulation. It's an established fact that somebody who stays alone and somebody who does not have a lot of people to speak to, stays in a damp area, if there is no adequate lighting, it's very quiet, they may develop more and more symptoms of dementia. They may forget more. Also, if there is too much noise, extremely bright area, too many things around, that also causes cognitive disturbances. So it should be just adequate. It should not be too much. It should not be too less either. Then simplification of tasks. Whatever task they are doing, they should be done and they should be taught to do in a very, very simple way. So much so that if we are asking them to say wear a t-shirt, all the steps should be broken down step by step and taught them. Okay, you open the cupboard, you take out the yellow shirt, you put the right hand first, then you put the left hand first. Every step of that task should be simplified and told to the patient. Then, of course, there are dementia support groups. Dementia support groups is both for the dementia people and for their caregivers. People who have dementia, they meet people like them, they speak to them, that gives them more and more stimulation to their brain. That helps them exchange how their experiences in life are, what all they forget, how do they cope up with it. These are the things which help in, which are there in dementia support groups. And along with that, there are other therapies which causes relaxation to patients, like some music therapy, like mild music therapy. In fact, in an Indian setup and with a lot of our patients, we see when they're very agitated, if we play some kind of a God-related song or some kind of aarti, they actually tend to settle down. They listen to it and become calmer. So any kind of music or any kind of song which they like, that can be given to them. Then aroma therapy. Studies have proven that certain aromas like lavender and lemon tree, they help in reducing the aggression of the person. And some kind of light exercises or art therapy, if it's possible. It's nice when they paint things or when they draw things. It makes them more alert and more useful. Now, after knowing all of this, we also need to know what is the prognosis, how their future is going to be, how is their life going to be. Now, quite often, people with dementia, they have a shorter lifespan. Women tend to live longer than men. Several features cause reduction in their lifespan, like they have difficulty in eating, they may be malnourished, they may not be able to swallow, and so on. Certain comorbid diagnoses like diabetes, heart failure, cancer, these also worsen the prognosis. So when somebody has dementia, it's important for us or for anybody for that matter who's taking care of a person with dementia to take in account the financial matters of the person, the legal matter, their safety issues, and the living arrangement. So now how do we approach to an elderly who has some kind of behavioral disturbance? And by we, I mean anybody who is not immediately associated with an elderly person. So while we are talking or whenever we speak to a person who has dementia, keep in mind, always preserve their dignity. Even if they have a lot of problems, they're not able to take care of themselves, etc., etc. Dignity-wise, they know They know their dignity is being preserved or not. Are they being humiliated? Are they being abused? They know all of that. So very important, preserve their dignity, ensure their privacy. When we are speaking, speak slowly, speak clearly, and if necessary, speak loudly. Whatever they are speaking, always give a empathetic ear, meaning nobody does any kind of activity without a reason. There is always a reason when they're doing something. Ask them their opinion, ask them their point of view. Why are you doing this? Or why is this happening to you? Assess for any kind of social support or whatever. How are they going to live? What social support do they have? Is there anybody taking care of them? See if there are any substances which they are taking, alcohol, tobacco and all. And if needed, refer to the doctor. While we are speaking to the caregivers, we need to know one extremely important thing, which is known as the caregiver burden. Now, caregiver burden is a relatively is an area which is not focused on too much. We often speak about the patient should be given this, patient should be given that, and so on. Nobody or not many people speak about the person who's taking care of them. So caregiver burden is something wherein we need to ask the caregiver, how are you? How burdened are you? Are you okay? Are you able to take care of this person? Ask them their difficulties. If somebody is too burdened with it. So it's basically like if wife gets a dementia, it's not only husband's responsibility to take care of her. It's everybody's responsibility in the house. So maybe taking turns and then taking care of the wife. Maybe one's husband can take, maybe one's son can take. So one is this aspect of caregiver burden. Another interesting aspect of caregiver burden is we had a patient very recently whose husband was fine. The patient had dementia, moderate kind of dementia, and seeing the pain of the patient, the husband would ask us, what is the point in her living like this when she does not have dignity, when she does not remember anything, she does not remember me, why should she live? So addressing such things, addressing such cognitions, or addressing such thoughts, that, how are you feeling about her illness? How would you like to deal with it? What kind of help do you require from us? Trying to giving them as much assistance as possible in the form of giving them numbers, giving them support for their daily needs and so on. So even when we are giving tips to the caregivers, we always tell them that ensure their dignity. How we go about it is we say that they are like your children now. The way we train our children to go to the toilet and take a bath and all of that, the way we train them, similarly, we have to train our parents also. But then remember that they are not our children. They are our parents. So their dignity, their privacy has to be preserved. Establish a daily routine for them. Give them a chair while they are taking a bath or a mat so that they don't slip. Give them some identifying bracelets or some necklaces in which there is a name, there is a diagnosis, and there is some contact number in case somebody gets lost. Locking door at nights in case somebody has wandering behavior. Maintain a daily sheet calendar. There is a date, there is clock, everything should be completely visible to them. Ideally, there should be a whiteboard where they can write their name, date, time regularly, and often the kind of questions which they ask repeatedly, maybe you can write the answer there. So whenever they get that question, they can see the whiteboard and not get agitated about it. Show them photo albums, show them or speak to them more and more about memories. Give them clothes which can be easily worn and easily taken out. So we would have seen that many ladies with dementia often wear gowns or nighties. Limiting water intake, especially before going to bed or during evening and night hours, so they don't have to repeatedly wake up to go to the toilet. Ensuring hygiene. If needed, give them bedpans or diapers. Then identify the triggers, what is making them angry, and try to avoid them. Give them some activities which soothes them. Go for a walk, speak with them, do simple tasks with them. So these are the common things which we tell the caregiver, which we tell ourselves also. If at all we are taking care of an elderly, this is how we should approach. And if the caregiver's health is not okay, it will be difficult for them to take care of the patient also. So addressing both the patient and caregiver becomes extremely important in this. So I hope I here want to stop and ask if anybody has any kind of doubt or they want to ask something before I move on to the case vignettes. Okay, I think we will first go ahead with the case vignettes and then come back to questions. Here, I would want everybody's active participation, because it's going to be pointless if it's just me talking. Let's try to see if we have understood whatever we spoke about so far. So we have this woman who is in her upper 60s, say in her early 60s, 62, 63. She was referred because of some concern about dementia. Family members feel that there is some decline in the memory from the past 4 years. She forgets conversations. She misplaces items, thinking that somebody would have taken the items, forgets to take doctor's appointments, gotten lost while she is driving her car. Patient's family also reports that her long-term information, like old memories, also seem a bit fuzzy. So like she remembers the vacations, but mixes up details of different vacations. Patient does not feel too concerned about her difficulties, and she's not even interested in taking her treatment, but family seems to be quite concerned. So anybody would like to say or comment on what this could be? Anyone, you can just unmute yourself and give your opinion. It's just us, so even wrong answers are absolutely fine. What does it seem like? Does it seem like there is a problem, or is it normal?
Seems normal to me, ma'am.
Seems normal. Okay. Anybody else would want to comment something? Okay, so here, why I would say it may not be fully normal is one, this lady is in her upper 60s, which means she's probably somewhere in her 61, 62-ish. There has been a gradual memory decline from the past 4 years, meaning somewhere in her late 50s, she started having some problems. She's forgetting conversations. She's misplacing items. She's forgetting to going to the doctor's appointment, getting lost while she's driving a car, mixing up old details. All these things do suggest that there might be some kind of problem in this person. Maybe not to a very severe level. Maybe she's in her early dementia kind of phases, but there is definitely a onset. So I would like to call this as probable Alzheimer's dementia, early onset.
Apurva, can you just hold on? Mr. Jagannathan, why you were thinking this as a normal? So
you are on the other side of 60. That's why I was thinking that, okay, see, because gradual, decline in the memory functions do happen to anyone. That is what Dr. Apurva said at the beginning. Therefore, I was not too concerned about that. I said, okay, probably she can finalize that after some, examination, the detailed examination of various parameters. That was my concern, doctor. Thank you.
So this is very, very important. Okay. So the most difficult thing for anybody is to distinguish from a normal aging to the initial dementia. If somebody is in a very severe dementia, it is much easier for the family or the doctors to make out. When it is in the initial, even for doctors, sometimes when they find this kind of a history, they may think that this is normal. So this is, even when somebody comes to us, we would take a lot of time, we would evaluate, we will then only come to a conclusion whether this is a kind of one-off incident, whether why it has happened. So what we need to remember is that people who are having once in a while memory problem, they're able to recollect, they're able to function independently. We are not thinking that they have a serious memory problem. But people who have consistently worsening problem and people who are having serious impact on their life because somebody is getting lost while driving a car, it is not something, a common thing. And the difference is like you might find it difficult to find the way and then you may search something. But the example in a person with dementia is they will be completely lost. They would not know as to how to come. They have to be helped by somebody. they will get stuck in a place and call the family member, or sometimes the family member have to search. Okay, so they will not use the usual problem solving skills and then come. Okay, so that is one thing. Again, that is happening in a familiar location. It is not like an unfamiliar location, like the place where you go for regular walking, you go one day and then not able to come back. Okay, that is something, an indication of a severe problem. So many times with this kind of a profile, when family has been noticing, usually we underestimate this problem as something like normal, we postpone it to get evaluated. The person also feels it is normal. So this is where awareness is required. So you should say in this stage, if we evaluate, there can be a significant benefit for their quality of life. Even if we are not able to cure, there are certain complications we can prevent. Their quality of life can be helped, and it will help both the patient as well as the family. So that is something which we need to. So that is why we are consistently doing these awareness programs. How much ever times we talk about this, it is not easy. So we will come back to this again and again, because I think this distinction is something we need to clearly remember. Okay, sir, Mr. Jamunathan, is it clear now? Have we helped you to understand better?
Thank you. No, I understand. I understand your concerns, and I understand that we see. In fact, I was about to tell that anyway it needs to be evaluated by a doctor. And see, but that was the final part of my reply. But anyway, I did not say that. But anyway, thank you, doctor. Thank you for all the inputs. It's very helpful.
Dr. Shivkumar, I have a question.
Yes.
Good evening.
Yes, sir.
Yeah, there's a phrase called age-activated attention deficit syndrome, ADS. Does it mean, in Kannada is called Arulo Murulo, Kannada. Okay, does it mean that this is the initiation of the dementia by any chance?
See, not everybody who has normal aging related memory problems get converted to dementia. Okay, it is not that 100% if you have a memory problem, you get dementia. That is definitely not a reason to get scared. So if you take a population of 65 and above, only 5% actually develop, 5 to 8% have dementia. If you take somebody at 85-year-old person, many of them will have memory problems. But if you actually see as to how much proportion they actually have dementia, maybe around 40% or 35 to 40%. So definitely it is not that anybody having what you say as a age-associated memory impairment, age-associated attention deficit. There are different terminologies what people tell. Okay. So sometimes it may just go on to remain like that in a very, very minor level for throughout their life. What is important is whether it is worsening significantly to affect their daily life.
I have a few more questions, but I will ask it only at the end.
Okay.
I'm Leela Reddy, sir.
Yes.
To prevent dementia, can we go for evaluation around 60s?
Okay. Very good. So I think who's asking the question, Miss
Leela Reddy.
Leela Reddy. Thank you very much. I think it's a very good question. So what do you suggest, Apurva? Do normal people have to get screened?
So, sir, I would here like to highlight the risk factors which I spoke about. Maybe everybody need not get screened. Only one, if they have those risk factors which I spoke about previously, like somebody having BP, sugar, somebody is having hearing loss, somebody's not educated well, somebody drinks alcohol, smokes, and so on. People who have these risk factors and they are feeling there is some kind of, even if there's the slightest of cognitive deficit or any kind of minimal forgetfulness they feel, it's good to get screened. It might help in a primary prevention, or it might help in the secondary prevention of the part that we are able to diagnose it early and help it prevent to a worsened level. Everybody need not get screened by a doctor when they touch 60. That probably may not be that necessary, is probably my opinion, sir.
Okay. So I think, Ms. Leela, I think this is a very important question. My take on that is there is no kind of consensus opinion that it is recommended that everybody has to mandatorily get screened. Simply because that as of now, there is nothing like a preventive vaccine we can give to you. Okay. But my answer to it will be there's nothing wrong in adding memory as another health parameter for you to get screened as a holistic package. It is not just, if for example, annual health checkup for an elderly person, should it include a brief memory testing? Possibly, yes. There are few questions, whether you have a memory problem or not, whether is it kind of frequently noticed or not, are you concerned about this is something like many people who have serious memory problem, they will not report memory problem. The report will be more observed by the family members. If you find, for example, you say that when you are worried about memory problems, it may be a much earlier stage. When you say that my memory is all right, but your family member says that you are forgetting again and again, you are asking the same thing again and again, and you are not aware of it, that is a next stage. So then it's not enough to get screened based on one self-report. I think what is more sensitive is also to kind of ask the family members who are closely living with them whether it is something significant problem is there or not. There are brief tests which are self kind of administered tests, or a psychologist or a trained doctor can administer, and you can get it screened. If you ask me whether it has been implemented, no, it is not implemented as a routine in many of the master health checkups. When we check BP, sugar, various other health parameters, memory is still not included. Let me tell you why it is important. The reason is that people are not aware if they develop even a serious memory problem. So they may be going to doctors for other things. It may be an opportunistic screening that can pick up problems, and you can prevent certain problems. For example, somebody is taking medications and living on their own and taking medications. Family may think everything is all right. One fine day, the person may develop hypoglycemia because he has forgotten that he is taking medication and he is taking the medication again and again. So you will not have an opportunity to prevent complication if you don't have a periodic screening. So the longer a person lives, the screening is much more required. I think because if you screen 100 people, dementia will be there in only 5-6%. But in somebody with 75 or 80, the screening is much more required, where you might pick up more people with cognitive impairment. Okay, so this is there is no yes or no answer, but if you are concerned, for example, somebody may have a family member having dementia, their father or mother. Those are people again who need to be more proactively screening because they are genetically prone for developing these memory issues. Okay, so
That's why my parents are above 90, sir. They have dementia. So I wanted to, because to avoid that, how can we go about it? I wanted to.
So one is screening. Second, I think Dr. Apurva has told about preventive factors. What can they do, Apurva? If somebody is concerned about dementia, what are the prevention strategies you would advise?
Prevention strategies could be, sir, like one is that their nutrition should be adequate. Their hydration, their hygiene, all of that should be adequate. And they should continue doing activities which keep them cognitively stimulated, or which keeps their brain active in simple terms, which can start from, if somebody is active and still it's at the initial stage, they can start doing some puzzles or Sudoku, which can keep their brain alert and active most of the time. They can, basically these kind of activities, they can do some memory training tasks, they can change their environment, they can get involved in more and more community kind of work, which can basically the whole point is to keep themselves cognitively more and more active.
So,
hello, ma'am.
Dr. Apurva has given a list of risk factors, like ranging from hypertension, diabetes, heart conditions, cholesterol abnormalities, say sensory function like your eye and vision and hearing should be good. Not to use alcohol at a level when it can be problem. Taking care of your weight, physical activity, preventing head injury, because in elderly, preventing falls, not wearing helmets, those kind of things can be much more costly. So these are all some of the things which need to do. And cognitive stimulation and social engagement. Again, this is something which is very important. Taking care of depression. Again, this is something, a risk factor. If you have depression, to get recognized and then treated. So pollution, even air pollution is considered as a risk. But some of the things like education is a very long-term kind of risk factors. The childhood education is one of the important protective factors. People who are read more, their brain strength or resilience is much more. So that is why they develop dementia much later. Okay. So things like yoga, physical activity, these things can be helpful. So what is good for heart is also good for brain. So these are all things, not only just to prevent dementia, it is to prevent multiple other health conditions, whether it is a heart attack, whether it is stroke, whether it is cancer, multiple health conditions, the same protective factors are there. So dementia is one other reason why you need to take care of these things. Unique for dementia is cognitive stimulation. So to remain cognitively active is something very, very important.
What about people having hallucination problem? Hallucination.
Okay, okay. So, Dr. Apurva, would you like to respond? How hallucination is relevant for dementia?
Yes, sir. So, sir, hallucinations can happen because of two reasons. One, there could be somebody who's blind, who's not having a good vision. They can have, because of the sensory deprivation, they can have what we call as a visual hallucination, any kind of hallucination, which is one cause of hallucination. Other cause of hallucinations is another form of dementia, which we call as the Lewy body dementia. Hallucinations help us, and also hallucination could be a part of, say, regular Alzheimer's dementia, but it could be a part of what we call as the behavioral and psychological symptoms of dementia. So within dementia, hallucinations can happen because of these 2-3 reasons. What we need to address when somebody presents to us with hallucinations is how to stop it, because that can lead to a lot of behavioral problems and behavioral changes in them. That can lead them to be more scared. They can lead to be more aggressive, which can cause problem to them and the others. So when it comes to hallucination, the first thing as a layperson we can do is take them to a specialist. Take them to a geriatrician, take them to a psychiatrist or to a geriatric specialist and get this evaluated. What is the reason of this hallucination? And if need be, it can be treated with certain medications like antipsychotics. So first, see if the vision is okay or not. What is the cause of these hallucinations? And depending on the cause, we give them the treatment. So at our level, we have to refer it to a person who is specialist in this.
So I think one point what you need to notice that not all dementias present predominantly with only memory problems. So if you listen to the first description of the person with dementia, what Alzheimer had actually diagnosed, the person Auguste D, she had predominantly psychotic symptoms or suspiciousness. It is a very rare type of dementias. That point of time, that is the one which led to the diagnosis of Alzheimer's disease as a condition. But what we now know is that there is some proportion of people will have more prominent psychotic symptoms, hallucinations, and they need to be treated as well. Okay. So they, if you find hallucination in somebody elderly person for the first time, when we evaluate, dementia will also be one of the reasons where we would evaluate whether the person is having dementia. Okay. Is it clear, sir?
Ma'am, there is a question from chat box by Mr. Keshav Krishna. He asked like which thyroidism is hypo or hyperthyroidism or more prone to dementia? Which thyroid factors relates with dementia?
Yes.
Please.
Yes, actually, the same question was also asked by Mr. Devendra. So, sir, thyroid, usually it's the hypothyroidism which causes or which gives symptoms suggestive of dementia. And this comes under this reversible causes of dementia domain, wherein if we treat the thyroid symptoms, this leads to improvement in their cognitive functioning. Now, why I'm calling it as a reversible dementia is because the symptoms with which the person presents to are similar to dementia. They may not present to us with complete memory deficit, but it may be that they are more slow. They are taking time to understand things. They are having difficulty in managing or planning things with some amount of, forgetfulness. So it's commonly the hypothyroidism, which when it's at a severe level, which presents to us with symptoms of cognitive deficits.
Okay. So I think one important thing you notice, hypothyroidism is very common. A lot of people nowadays get screened by doing a blood test and then they will be on treatment. So not all patients with hypothyroidism develop dementia. If you see the number of people who have hypothyroidism and who have developed dementia because of hypothyroidism, it will be very, very less number. Okay, so the hypothyroidism should be that severe by itself to contribute to dementia. So when we screen people who have cognitive impairment, when we detect hypothyroidism, we treat it to make sure that that is not adding on to one more risk, one more reason why a person is having memory problem. Okay, so 90% or even 95% people who are having hypothyroidism, even if we treat, their dementia may not recover completely. In some proportion only, where it is only due to hypothyroidism, that will improve. Okay, so in other people, it will help in some way. It will not completely reverse the memory problem, but it will be to whatever extent hypothyroidism contributed to the memory problems, that level it may improve, but it will not completely take away the brain degeneration. Okay, so you need to, you should not get alarmed. I am having hypothyroidism, so will I develop dementia? So as long as thyroid is controlled, it's treated properly, that should not be an issue. Okay. So, Apurva, I think you have anything else to be presented?
I have a few more case vignettes, sir, but if we are short on time, we can skip
I think it will exceed the time. So, maybe I think the take-home messages is something like how to distinguish a normal person, normal age-related memory issues to dementia. So that is something which is very important. Mr. Jambunathan asked that question. So it is, we don't need to get alarmed that once in a while I misplace my key, once in a while I am not able to recollect a name. It is not an indication of dementia. It is primarily when it is happening consistently and it is much more noticeable by family members. You are not able to do your normal activities that you have been, for example, you are managing the bank accounts earlier. Now you are doing more errors. When you are going for a shop, you are not able to calculate the change properly and get things. You get lost on a familiar places. So if it is happening consistently, that is when dementia is much more likely. Second, we also need to know why are we talking about it when we say this is not a condition where it is curable. Many times people, as of now, there is no curative medicines for dementia, for many of the dementias and particularly for Alzheimer's dementia. What is important is even if there is no cure, many people can be provided appropriate care and their quality of life and safety can be ensured if the family member knows this person has dementia and then they provide appropriate supervision and support. Otherwise, many times what we see is that sometimes the person will be lost and they will never be found back. The family members would not think this person is having a problem. They will realize only the person has been lost. And this person will end up in a very poor state of condition of living, and till they actually trace that person and then find and then rescue them. They can get into accidents, they can get into falls, fractures, all those things if a proper care is not given, because their judgment is disturbed. They cannot safeguard themselves when they go travel independently. So that is something like supervision is required. Care arrangements, many times people, when they are having a mild dementia or even the early stage cognitive impairment, they can take decisions about their properties, they can take decisions about their future care, if they are aware in the very early stages, the family member and the person can plan for their future, how they want to be supported, what decisions they have to take. Because after an advanced stage, they may not be able to take a decision. They may not be able to exercise their choice. So these are all some of the things. Treatment, even though it is not curative, treatment can help in improve quality of life. Supportive care is something which is very, very important. Supporting the carer is very important. And prevention is another important reason why we talk about it. Prevention, early diagnosis, and then providing appropriate care is something which is possible. And maybe say there are some recent developments that has happened which gives us hope that there may be some curative medicines that can come in the maybe next few years or next decade. This is something like, because continuous research is going on. In US, there is a latest drug that has been launched, which is possibly the most advanced kind of treatment, which they expect to kind of change the course of this condition. But still, we need to wait for a few more years to see whether it is really successful or not. So I think one need not be very pessimistic. So there is a hope of getting better care and better cure in the future. But even if there is not possible, I think you can make a difference by identifying these conditions. So I would also like to add that NIMHANS is initiating one of the programs supported by ICICI Securities, what is called as Alzheimer Seva, support enabled through volunteer assistance. So here we are training volunteers who will go and screen elderly people, who will also go and promote awareness in the general public. In this month, we'll be launching that activity. If any of the senior citizen is interested to join this initiative and want to get more trained about Alzheimer's and then become a volunteer to educate senior citizens or educate other people, you are welcome to join this initiative. Okay.
What are the qualifications for that, doctor?
Pardon?
What are the qualifications for joining a
anybody who can contribute can join. Anybody can join, and then we will train them. Say they should be willing to spend some time to serve people, to kind of educate more people about dementia. And sometimes if they are, they can provide some assistance by screening elderly people. That also can be done. But I think a simple education doesn't require any big qualification. They should get oriented, and then they can actually in turn help another 10 people. So that is what we are looking at.
Thank you, doctor. Thank you. It's a nice initiative.
Yeah, this is something, a program which we are going to launch this month. And so I also would congratulate Apurva. She is our young trainee who's doing fellowship, and she did a good job of presenting this information. And thanks for good questions and then active participation.
Thank you, Doctor. So in fact, I should congratulate Dr. Apurva. This is an excellent presentation. We never had any, but she was not stopped at all.
Thank you, sir. Thank you so much for your patient listening.
Mr. Nagaraj Rao said some more questions are there.
Yeah,
so
yeah. I have about 4 or 5 questions. I'll put them together
so that you can ask,
combine and then answer me. First of all, I would second Jambunathan's idea that it was a wonderful presentation, understandable, easily understandable presentation. First question will be something like, what is the major difference between dementia and Alzheimer? Second, does the Alzheimer patients have less production of saliva? I read somewhere else. As a yoga practitioner, is it yoga and meditation, would that help in preventing the dementia? The fourth is, I have read that cells, the neurons get lesser and lesser as the age progresses. Is it a cause for dementia? Indian Institute of Science has come out with a special protein identified, which is the causative, information on dementia. Could something be done on that? Protein or fructine, something like that. And twinitis, the ringing of the ears, is an indication that if you don't take care, it may lead to this thing. Above all, how much of stress factor is responsible for dementia? I'm sorry to putting all the questions together so that you can combine everything and then explain. Thank you.
Yeah, I think lot of question. I think some of the things I already discussed. I think I think this is one common question that comes. What is Alzheimer's? What is dementia?
So, sir, thank you for such elaborate questions, which shows that you are extremely interested in the subject and you've heard quite a lot of things. So, one starting with difference between Alzheimer's and dementia. I think I mentioned in my presentation as well, dementia is an umbrella term. And within the dementia, within the umbrella of dementia, we have different types of dementia. The Alzheimer's is a type of dementia. Along with Alzheimer's, there are other kinds of dementia, such as frontotemporal dementia. Then there is Lewy body dementia. Then there is vascular dementia, Parkinson's dementia, and so on. So the umbrella of dementia, sorry?
Dementia also you mentioned.
Yes. So within the umbrella of dementia comes Alzheimer's as well. So Alzheimer's is a type of dementia, to put it very simply. Then, sir, your next question was
yoga and meditation.
Yoga and meditation, yes. So, sir, yoga and meditation. Now, there have been studies which show that yoga and meditation also helps in improvement of cognitive functioning of people. There are, in fact, in NIMHANS, there is a yoga department dedicated. Like there is a proper dedicated yoga department, and they have a separate module for improvement of memory and for improvement of cognitive functions. And they do specific asanas and they do specific brain exercises pertaining to yoga, like breathing and so on, which helps them improve. The whole point of doing yoga is basically to channelizing your energy and keeping your body more and more under your control. I'm not sure if it helps in memory or if it helps in I don't think that we can revert dementia back by yoga, but definitely it helps in reducing the progression. The way we have our medication, which increases the span, likewise, maybe yoga and other relaxation exercise can help in increasing the span, along with the span of dementia. Along with that, yoga and relaxation exercise help in reduction of the behavioral problems pertaining to dementia. It makes you calm, it makes you more relaxed, because of which the behavioral problems we get, irritation and anxiety and depression, that can come down because of yoga. So definitely, along with our routine exercises, physical exercises, mental exercises, and medications, and add on an integration with yoga is definitely helpful, like may help for sure.
Yeah, just one point is that, say, physical activity is one of the risk factors for dementia, physical inactivity. And yoga, along with physical, there may be a cognitive benefits also. But no single factor is responsible for prevention. It is always multiple factors. So if somebody is a yoga teacher or a yoga enthusiast, it doesn't mean that they can never develop dementia. So if their genetic risk is more, if their brain is damaged because of head injury, or there is some other stroke is there, they may develop dementia. So if they, for example, they have, say, when we talk of prevention, we always talk of multi-domain kind of prevention methods, like taking care of your good health in terms of diabetes, hypertension, physical activity, cognitive engagement, sensory, kind of taking care of your senses, sensory function, hearing, vision, everything helps. It is not just only one factor. Yoga has a preventive role as one of the components. Okay. So that is something which we need to, and there are studies which have shown that yoga can improve cognitive function compared to somebody who is not doing any activity. So there are studies which have shown physical activity programs, aerobic activity programs also improving cognitive functions. So it is there.
Why I asked this question is, attended the seminar of 5 series conducted by NIMHANS on the brain, the effect of the brain on the, the dementia, etc. That's why I was interested to know. This question, Dr. Apurva, is on saliva. Would there be a reduction in saliva in Alzheimer's?
I have not come across any studies saying that, sir. I don't think, I'm not sure if there is any reduction in saliva because of dementia. There may be some other reasons, because of their activity, because of their forgetfulness, because of the medications, which can cause reduction in saliva. But per se, because of dementia, I am not sure, sir. Like PT sir, would you want to?
No, I don't think it is a major association. Many times, sometimes newspapers or some reports will blow up certain things is very trivial or very minor observation as a big thing. So, for example, you told about one protein being discovered. Yeah. There are multiple proteins that have been discovered. So, in fact, what is Dr. Apurva said, 1906, we knew that some bad proteins gets accumulated in the brain. So there are, despite knowing that, there are challenges for us to give effective treatment. So it is still, we are able to diagnose people based on some CSF tests, based on some special scans. So there are many such research findings are there, which sometimes may come in newspapers. But so far, nothing which is resulted in a very effective curative treatment has come. So that is something which needs to be remembered. Okay. I think we have addressed most of the things. I think it is quite late. Anything else is pending, sir?
Deficiency of cells through age.
I think that is something like you said with age, brain cells decrease. So that is one of the important factors, because why people above 85, people above 90 have higher rates of dementia, because when the brain degeneration that happens, there will be a tipping point when this pathology will lead to manifestation of symptoms. So people have looked at longitudinal aging studies have looked at people who have brain aging and brain shrinking. Still, somebody has maintained normal. So even at 90 years, there will be somebody who will have brain as shrunken, but still they may be able to do well. But because of some other reasons, in some people, they are having more likelihood of developing dementia. So that's why above 85 and 90, almost 45-50% will have dementia.
Last question is on stress.
Stress levels. Yeah, stress. What is your answer, Apurva? Stress
causing dementia. It's a bi-directional thing, sir. I mean, I won't completely say that stress causes dementia and dementia causes stress. It's not like, I mean, it's a bi-directional thing. It definitely can make somebody more prone to dementia, more prone to developing dementia. It may act as a risk factor, but only person who is very significantly stressed may not surely gets dementia. Yes, it definitely puts them more at risk, and we should practice all the measures to have as less stress and be as less depressed as possible for us to not develop dementia in future.
So studies have actually shown link between chronic stress and then increasing risk for cognitive decline and dementia. And stress also contributes to increase in depression, and that itself again contributes to risk for dementia. So stress is a mechanism which damages your health in multiple ways. Brain also is not immune to it. Brain also can get affected. But as I told, it is unlikely that only stress will lead to dementia. Many times patients will come and tell, the family members will come and tell, my father had a problem with one of the son, and the son has walked away from house, or he is not in good terms with the condition, or there is a financial loss that has happened. So that's why he has developed dementia. So many times we give an explanation. Okay, this is why it has happened. But in actual terms, it is much more complex. It is never one single reason why a person developed dementia. Okay, so it's an explanatory mechanism for us. We say that there is a stress, there's a person has developed dementia. We'll always link it and say, okay, this is why this person has developed. It need not be true all the times. It might have just been one of the contributing factors. There are sometimes a person could have developed a financial loss because he is having cognitive impairment, he's dementia, he is taking bad decisions, he would have got into loss. So that's the other way around. Okay. So I think any other final queries from any other participants, senior citizens, any other queries, anybody we have missed out? I think Mr. Nagaraj Rao has asked lots of questions for everybody. And he is the senior most, I think. So
he's the most eligible person at that. most eligible person to ask questions.
Yes. He's the senior most healthy person. I think he's an example. Sir, your age is
He's already 86.
Huh?
86.
So that is why aging is heterogeneous. So 80, 84. Okay. So Dr. Mr. Nagaraja looks like 60s and 70 maximum, 60s. So that's good. That's good. He's also a yoga enthusiast. So that's good. That's good.
Thank you, sir.
Very
good explanation. Very useful. And,
Thank you, ma. Thank you.
Thank you.
Thank you. Thank you very much. Thank you very much.
That 1 minute, just I want to tell you. Doctor,
Yes.
1 minute.
Yes.
Actually, I am 72 years old, doctor.
Uh-huh.
I am doing meditation regularly from the last 15 years. By doing meditation, actually my memory power has increased. Even I am still remembering my younger days.
Yes.
Just I want to share.
Yes, very good, sir. I think one of the other misconception people have, I want to clarify. I think your memory is good. I'm very happy. But many times what people think is when somebody remembers a lot about younger days, that means the memory is all right. What we need to understand is that in dementia, the first thing to lose is what is happening today, what is happening yesterday. The last thing to go will be the childhood memories. Because there is a Robert's law which says that reversal, how the memory patterns has formed in your brain. The first thing that is formed is the first thing to go last. The latest one will go first. Okay. So if somebody is talking a lot of things about only the past life, their childhood, their parents, they are not talking of the current affairs. Again, that is a warning thing, like where somebody needs to, they should not think that, oh, this person is able to recollect 30 years back what has happened. The person is able to recollect 40 years back what has happened. If it is good to have this memory, but if the person is talking only about that or predominantly about that, one has to get evaluated also. So it is, I think it is nothing, is no way to kind of put you down. It is more because a lot of people have this misconception. When we ask memory is all right, they'll say, no, I can remember childhood. What we mean is about what is happening today, what is happening yesterday. Whether you are able to remember who had come today, who had come yesterday, what food you had, what is the event that is happening in your neighborhood, newspapers, what is the event, are you able to remain updated? So that is the first thing to be lost.
Doctor, you may be correct, but old memories are also useful if anybody is hearing. Likewise, current memories are also useful if it is somebody is hearing. If interaction is going with 2 persons or 3 persons, or in a meeting, question and answer like that, the improvement of memory will be much more, I think, in my experience.
Yes. Now, old memories, to talk about it, to share it, and then to cherish it, it's very good. What I'm saying is, if you are if you are forgetting the current ones, you should not underestimate that. You should not say my memory is good because I am able to remember the old things. Okay, so that will be the one which will go last. And if it is more often, people are only talking about the old things and they are not up to date with the current what is happening. They are
they are not reading newspapers. They are not having a friendship with like my seniors or juniors or middle people, relatives. This is one of the reason for shrinking memories, as you observed.
Yes. It may be an indication of memory problem. Okay, if somebody is talking only about old things, it may be an indication of memory problem. That is why I was telling that.
Okay. Thank you.
Okay, fine. I think we will conclude, Apurva. Excellent presentation and good discussion.
Doctor, a small word. I really appreciate the efforts put forth by Dr. Apurva. She has explained very nicely. I'm sure under your supervision and your instructions, your advice, she has done much better. And let her, we wish all the best, so that she will come out with a protein or some sort of a thing.
So Apurva has done on her own. I have not, because we also use this as a kind of a training for them. So they have to prepare themselves and they have to present, and because they are more likely to lead these kind of initiatives in future. They're all experts. So Apurva has the entire credit for her presentation.
There's a lot of clarity in her own explanation.
Yes.
I mean, that's what I see. All the best, doctor.
Yes.
Thank you so much, sir. Thank you. Those words are extremely encouraging.
Very good. I think it's an experience for her also. Yes. And there are more and more opportunities where they will have to go and interact with senior citizens and do educative awareness programs. So yes, very good. For all the students, it is a learning experience to kind of know about the questions and then try to explain things and try to promote awareness. That's an integral part of being a doctor. So that is or any health professional. Okay. Very good. I think Annapurni, who's going to conclude?
Yes, ma'am. Yes, sir.
Yeah.
So we have come to an end of a session, and participants, those who have queries, you can mail to us because you have a lot of questions to ask, and we will definitely reach to you. And to conclude, I just quote a saying like, according to Indian statistics, it was around 5.3 million that has been taken in 2020. 5.3 million people are affected with dementia, and it is being projected to reach around 14 million in the year of 2050. So it is a high alarming state to make awareness about dementia, and that is a great thing which our HOD, Department of Psychiatry, Geriatric Psychiatry, or PT Shivakumar has taken this initiative to spread awareness regarding dementia among the public. And thanks a lot, sir. Thank you very much. And you have done a great, you are the backbone of our VMS activity, and you have just supported us in various ways in reaching or in propagating the dementia awareness to the public. And this is one of the initiatives he has taken us. And thank you, sir. Thanks a lot. I also extend my heartfelt thanks to Dr. Apurva, who is doing a fellowship course in geriatric psychiatry, and she has explained in a detailed way about the dementia, Alzheimer dementia, and all people, like I hope like all participants have understood very well. Thanks a lot, ma'am. You had made the session very interesting and quite knowledge seeded to the participants. Thank you, ma'am. Thank you very much. I also extend my warm thanks to all the YouTube participants and also our Zoom participants. And at last, I just thank all the partners who have been with us, like the Government of Karnataka, then Indian Psychiatric Society, Karnataka Chapter 1, Karnataka State Legal Service Authority, Bangalore Apartment Federation, Happy 60 Plus, Samadhana Counseling Center, Icon Lives Series, REC Foundation, NSC Foundation. Once again, I thank you all and wish you all the best. Thank you. Thank you very much.
Thanks for all.
Thanks.
Thank you so much.
Thanks,
Thank you.
doctor. In fact, it was good knowledge sharing, I should say.
Thank you, sir.
Has been shared. Thank you. God bless all.
Thank you. Thank you very much, sir.
Thank you a lot.